I'm Dr. Dixon. You're here because you're planning on getting a hip replacement, and we're going to talk about the risks and benefits of the surgery, as well as things we need to do as a team or make this successful. So, in this packet that you've been given is your consent form, which I've highlighted, the risks that I'm most concerned about, as well as some instructions for before surgery and some instructions for after surgery. And I'll be referring to this as we talk. So these risks talking about strokes, pneumonia, um, heart attacks, and allergies to anything we give you in the operating room, those are risks with any surgery. The main risk with the surgery is infection. Why is infection such a big deal? Because the metal and plastic that puts on your hip do not have a blood supply, just like your clothes don't have a blood supply. So bacteria, which comes from your skin, gets on that metal and plastic. Now we have an infection we cannot get rid of by just giving you antibiotics. So if it gets infected, it means another surgery to wash it out. Sometimes we have to go in there and take all that metal and plastic out of your hip, leave you without a hip for at least 2 months, and then go back in there and put in your hip there. It's a nightmare for everyone involved. The national average for that is extremely low, but it doesn't mean it's zero. So how do we decrease that risk? Well, I want you to take a shower with an antibacterial soap the night before and morning surgery. And the antibacterial soap I want you to use is Civiclines. You can get this at CVS or Walgreens or any drugstore. I know it's carried at CVS and Walgreens. This helps to decrease the amount of bacteria that normally lives on your skin. How do you take that shower? Well, I have an instruction sheet in my packet here that tells you how to take the shower, but I'm just going to go through it with you. You take a regular shower. Use your regular soap. After you rinse off your regular soap, use a Hibiclin soap on your rag with a little bit of water. Turn off to get a lather. Turn off the water. Go over your whole body except your private areas and your head and neck, and let it sit in your skin for 3 minutes with the water off. After that 3 minutes, turn the water back on, rinse it off, you're done. If you get any cuts, scrapes, and sores on your leg from your toes up to your rib cage, we're going to have to cancel the surgery. Those increase your risk of infection, and we're not going to take on that risk. Do not shave your operative leg for at least 5 days before surgery. That also increases your risk of infection. When you come to the surgery center or the hospital, wherever you're having your surgery, they're going to scrub your hip multiple times, different cleansers. You get back to the operating room, put the sterile surgical prep on your leg, which actually adheres to your skin, and then we'll give you some IV antibiotics right for the surgery. If you're planning on going home that same day, we're going to give you IV antibiotics before you go home, and then you'll take some pills of antibiotics at home, which I will send into your pharmacy for you before the surgery so you can have them at home. If you end up staying the night at the hospital, then we're going to give you the IV antibiotics overnight. Even though I take all the steps, there's still that risk of infection. So infection, bleeding, if your blood count is normal, you have a very low risk of having a blood transfusion after surgery. We rarely transfuse blood for the surgery. Blood vessel injury. There's an artery on the inside of your thigh called your femoral artery. I look out for that artery and protect it. If it's injured, I will have a vascular surgeon repair it right then. That's extremely low risk. Nerve injury, femoral nerve, sciatic nerve. Those can be injured or stretched in surgery, in which case you have some weakness or numbness in your leg. The most commonly reported nerve to be injured is the sciatic nerve, in which case you have weakness with bringing your foot up towards your face. You can still walk, you have to wear a brace on your foot, and we'd expect the nerve to recover over 6 months, most of the time. We look out those nerves and protect them. I have yet to see it happen, but it doesn't mean it can't happen. Pain. You are going to have pain after surgery. The first few days are the worst, and then it gets better very quickly. By 4 to 6 weeks, your pain should be better than it is now. Not gone, just better. Between 6 weeks and 3 months, you're starting to get back to your regular activities. It takes about a year from the time of surgery to all the aches and pains around your hip finally resolve. And we expect about 90 to 95% pain relief out of the hip replacement at a year after surgery compared to where we are today. Leg length discrepancy. Most of the time, you have a leg length discrepancy before surgery from a bad hip arthritis because you've worn through this joint space and you've worn through some of the ball. We'll get that leg length back, but there's a chance your operative leg could be a little longer or a little shorter on your other side. We're talking about a few millimeters. Your body can adjust up to 5/8 of an inch or 2 centimeters of difference before you have to wear a shoe lift on one side or the other. Now, I do take pride in get people's leg lengths back equal, but that is not as important as stability of the hip. You've heard people dislocating their hips after the ball pops out of the socket. So in order to keep that ball in the socket, I have to tension all the muscles, ligaments, tendons go from your pelvis down to your thigh bone. Those tissues pull that ball or hold that ball in the socket. So if I lengthen the leg, that puts those tissues on stretch, providing more force in pulling that ball into the socket. So my point about telling you all that is, if I have to lengthen your leg more than we want, In order to keep your hip stable, I will. As opposed to keep your leg lengths perfectly equal, but your hip being unstable and dislocating every time you turn around. In surgery, I make sure your hip is stable in every position possible. But after surgery, if you put your hip in a bad position and have enough force behind it, you can dislocate it no matter what I do. So that's why I have the hip precautions written on this instruction sheet for after surgery of what to and not to do. And they're pretty strict for the first 2 weeks. Pretty much no break in the 90 degrees where you're not bringing your knee up towards your chest and you're not rotating the hip, big rotations. And physical therapy is going to work with you, or the nurses are going to work with you on what you can and cannot do after surgery. And that's part of your criteria for going home. Blood clots can form your leg up to your lung. If you've never had a blood clot before, then you're going to take a baby strength 81 milligram aspirin 2 times per day for 30 days. If you've had a blood clot in your past, then you're going to take a stronger blood thinner for at least 6 weeks. And again, that's to prevent blood clots from happening. Fracture, breaking a bone. Anytime we work with bone, there's a risk we can break the bone. Your bone quality will dictate that risk, but also arthritis can weaken the bone. If I see any weaknesses of the bone or I cause a crack in your bone, I will take care of it right then. Just like you can fall today onto your hip and break it, same risk after surgery. This does not prevent that happening. Wearing the hip out. We expect this hip to last a long time. Usually what wears out is the plastic liner that goes between the metal socket and the ceramic ball. If that piece of plastic wears out, we take it out, put a new in. The metal can loosen up for the bone. We don't see it happen that often, but if it loosens up, we have to replace that portion that does loosen. So by doing this procedure on your hip, you do have a risk for future procedures. So if it were to get infected, if it were to wear out, if it were to break it, fall and break it, or dislocate, come out of socket, we'd have to go back in and do something else to take care of the problem. Some people have no pain after surgery, and I hope that's you. The problem with that is you're still healing. Remember, I have to sew up tissue layers as I'm exiting the hip, and those tissues have to heal. So I can't let you do everything you want to do right after surgery. So I do limit how much weight you put on that hip for the first 2 weeks. Partial weight bearing for 2 weeks using a walker. And that's just to allow all the tissues in that hip to heal. For that reason, I don't really care about you doing physical therapy for the first 2 weeks. Again, because I don't want them to do some strength exercises and disrupt those repairs. Finally, when we're working on the bone, little microscopic bits of bone can get to the muscle and can start to grow. That's called heterotopic ossification, because bones growing which should not grow. In order to prevent that from happening, I usually put you on an anti-inflammatory after surgery for at least a week. And that prevents that from occurring. It's also going to help with your pain, but its main job is to prevent that extra bone from forming. If you can't take an anti-inflammatory for whatever reason, then before the surgery, we'll do some other procedure to decrease that risk, and that's usually a radiation treatment to the hip. We're going to go through the post-operative instructions for total hip replacement. I have these in your packet, and I've underlined the stuff I've already typed out, but I'm going to go through it with you. Keep this on your refrigerator. Keep it someplace where you can refer to it, because it's important for after surgery to follow these instructions. You leave the dressing on. It's an antibacterial dressing. It's impregnated with silver, which is a natural antimicrobial. So we want it to stay on your skin. It's protecting the wound from the bacteria that lives in your skin normally. It is water resistant. What's water resistant means? It means you can take your showers just like usual. But it's not waterproof. So that means no pools, no jacuzzis, no soaking or scrubbing around the dressing. We want it to stay adhered, so we don't want to put any lotions near the dressing. If it starts to come up, starts to loosen, take it off. The last thing we want is water from your shower getting inside that dressing and sitting on the wound. That would cause an infection. We talked about blood clots earlier. So you're going to be on a blood thinner after surgery. Whether it's, if you haven't had a blood clot in your past, then you're going to be on aspirin 81 milligrams 2 times per day for 30 days. If you've had a blood clot in your past, then you're going to be on some kind of blood thinner for at least 6 weeks, a little bit stronger. When you get home, you're going to restart all your regular medications, your prescriptions, your vitamins, your supplements, just like usual. There's going to be a stocking that puts on your leg. It's called a TED hose. It's about up to mid-thigh or upper thigh. You're going to wear it on your operative leg only. It's up to mitigate the swelling that's going to occur from your hip replacement. You don't need to wear the one on your other side, your non-operative side. That's your spare. The stocking you wear during the day. You take out for sleep, take out for showers. Usually you have to wear that for about 2 weeks. Okay. You are going to get swelling in your leg. It's going to be swollen for about 3 to 6 months. It's going to get better all the time. but there is going to be some amount of swelling there for 3 to 6 months after surgery. Physical therapy. We talked about earlier that some people have no pain after surgery, so we're going to relax the hip. We're going to be partial apron for 2 weeks. For that reason, I don't care about physical therapy for the first 10 to 14 days. You're going to get physical therapy in the hospital, or nurses are going to work with you at the surgery center to make sure you're safe to go home. That's it. At home, you're going to rest the hip. You can walk using the walker, but no physical therapy for the first 10 to 14 days. At that 2-week appointment, when you come back to see us, then we're going to start physical therapy, provided everything goes okay with surgery. Icing your hip. I can't emphasize the importance of icing your hip. It helps the wound to heal, helps to decrease the swelling. As long as there's a layer of cloth between you and the ice, it's unlimited. Having said that, if you put the ice directly against your skin or on the dressing, that's too thin, then it's 10 minutes on, 10 minutes off. You're going to get frostbite if you do it longer than that. Hip precautions. We talked about this briefly in the preoperative video. I'm just going to review them. It's written on your instruction sheet, but there's no break in the 90 degrees between your torso and your thigh. It'll go past 90 degrees, and then no rotating the hip, no big rotations. And that's only for the first 2 weeks. After those 2 weeks, then we're going to let you pretty much do anything you want with your hip with 2 extreme positions to avoid, and we'll go through those with you at that time. On this instruction sheet, I've made a list of the medications I'm going to send you to pharmacy. Pain medications, antibiotics if you're going home the same day, and then some laxatives, and then the anti-inflammatory to prevent extra bone from forming in your tissues. I'm going to mark those for you. I'm going to send them into your pharmacy before the surgery so you can get them before the surgery. Just make sure you take this to the pharmacy and make sure you pick all those up. And so that's the end of the post-op instructions for the hip replacement. I hope you understand everything I said, and please refer to your instruction sheet, and you're going to do great with this.